ഒരു യാത്ര.
എനിക്ക് തോന്നുന്നു ഇന്നലെ മറ്റേ പ്രശ്നങ്ങൾക്ക് ഇടയിൽ കിടക്കുന്ന സമയത്തായിരിക്കാം മിക്കവാറും. പ്രശ്നങ്ങളൊന്നുമില്ല. എന്റെ ഷെങ്കൻ വിസ അവർ ലെൻസ് വെച്ച് നോക്കുന്നത് കാരണം ഇവിടെ ഒരുപാട്.
He is the vlogger who was on a bike trip in Europe. At Azerbaijan, he had to drop his ambitious plans due to the outbreak of the corona pandemic and return to Kannur in Kerala. The vlogger, Ballu Traveller, was immediately taken to an isolation ward on his arrival at the Kannur airport. He tested negative and after 3 days stay in an isolation ward, he was released.
എന്റെ റിസൾട്ട് വന്നു, നെഗറ്റീവ് ആണ് കേട്ടോ.
The clean state-of-the-art government hospital service in Kerala has been its biggest weapon of defense against the spread of the corona pandemic. The first case of corona-positive patients in India was reported from Kerala in February. And within days, the Kerala government announced a state calamity. 3 students arrived from the epicenter of the virus affected Wuhan district of China. The first patient landed in Kochi from Wuhan. She was recommended to be in home isolation. Her condition was closely monitored by the health department officials. As soon as she developed symptoms, she was shifted to the nearest hospital with an isolation facility. Even before the test results arrived, the state government had identified others who had travelled with her. By the time she had tested positive, 2 other friends who returned from Wuhan were shifted to isolation wards in Alappuzha and Thrissur districts. All 3 recovered completely.
People might think that you will not be allowed to do anything, or it will be a very boring time over there. How did you spend time over there?
Actually, my isolation days was quite normal because I could use my phone. They provide me with Wi-Fi and all, so I could use social media and I watch movies. Yeah, everything was normal. Just we can't go outside that day.
Even after she was discharged from the hospital, the counselling team would reach out to ensure that the patients were emotionally stable. On March 8th, Kerala Health Minister K.K. Shelja announced that 5 new cases were detected in the state. The cases included a 3-member family which had come from Italy as the primary carriers and 2 of the relatives in Pathanamthitta. The family did not follow the home quarantine guidelines and roamed around for over a week. It created wide panic in the state as close to 3,000 people in Pathanamthitta, Kottayam districts were included in the primary and secondary contacts. Efforts by the district administration ensured that most people who came in contact with them were traced. 4 such people later tested positive. Similarly, many other patients who had come from various other countries were identified before they could cause a community spread.
ഇത് നേരത്തെ നമ്മൾ പോസിറ്റീവായി റിപ്പോർട്ട് ചെയ്ത കേസുകളുമായിട്ട് ബന്ധമുള്ളതാണ്. അവരുമായിട്ട് ആ സ്റ്റുഡൻസുമായിട്ട് ബന്ധമുള്ളതാണ്, അവരുമായിട്ട് ഡയറക്റ്റ് കോണ്ടാക്റ്റ് ഉള്ളതാണ്. നമുക്ക് എല്ലാവർക്കും അറിയുന്നതാണ്, ഇതിന് പ്രത്യേകിച്ച് മരുന്ന് കണ്ടുപിടിച്ചിട്ടില്ല. കൃത്യസമയത്ത് ഈ കാര്യം റിപ്പോർട്ട് ചെയ്യാനും ഐസൊലേറ്റ് ചെയ്യാനും ചികിത്സ കൊടുക്കാനും കഴിഞ്ഞാൽ ജീവൻ രക്ഷിക്കാൻ കഴിയും എന്ന പ്രതീക്ഷ തന്നെയാണ്.
Kerala has a record for having the most number of COVID-19 testing centers, and this is also the state where the maximum number of tests are done. During the Nipah outbreak, Kerala had to rely on the National Institute of Virology, Pune, to get swabs tested. But 2 years later, the state has set up a satellite center of the NIV in Alappuzha approved by the ICMR. The state expanded the number of facilities with the help of microbiology labs in various hospitals and other research establishments. Now the state has 10 testing facilities across the state which are accredited by the ICMR. But a shortage of testing kits is slowing down the entire process.
We have very good planning earlier itself. As you say, Nipah incident is a very good experience to us. With that experience, we have planned everything earlier. And all other departments are also helping us.
The state has already announced a package to tide over the coronavirus crisis. The Rs 20,000 crore package includes food for all through the public distribution system and loans worth Rs 2,000 crore through the Kudumbashree scheme. Another 2,000 crore rupees have been granted by the state government for Employment Guarantee Program. It has also announced 2 months welfare pensions in advance. Equipped with the past experiences of dealing with natural calamities like the 2017 Kochi cyclone and the 2 consecutive years of floods and the epidemic outbreak of the Nipah in 2018 and 2019, has put all the right measures in place to fight the corona pandemic.